Something that's somewhat difficult to try to determine is your runny nose and cough due to an allergy or to a cold. One clue that I see of is more or less how much the person is sneezing. With a cold, you'll sneeze a little bit. With an allergy, you usually sneeze a lot. And usually there's a lot of itchy nose there too. Those are the patients, is when I'm talking to them, they constantly are rubbing their nose and all that. For those things, it's the over-the-counter antihistamines work the best. In fact, right now there's very few prescription antihistamines and stuff, with Claritin and Zyrtec and Allegra all going over the counter. Right. Sometimes that's where to start. If you know it's allergies, particularly if you know that, every time you get near the cat, you start sneezing and have an itchy nose, that's an allergy. Right. Right. First, start off with those over-the-counter medications. If those don't work, there are some steroid nasal sprays that you'll have to see your doctor for, and he can prescribe those too. Right. A lot of times, what I'll do is that we'll have a patient use both of those, both the over-the-counter antihistamine and the prescription steroid spray. And if that controls their problem, great, you're done. And you just need it every now and then, nothing else needs to be done. But if the problem continues and is pretty severe, then you may need to be referred to an allergist. What he's going to be doing is doing some allergy testing on you to see exactly what you're allergic to, so you can maybe try to stay away from whatever it is you are, and to see if maybe you need allergy shots. Seasonal allergies basically are caused by the seasons. It's you only get them like in the spring when certain flowers are in bloom. Whereas the regular allergies a lot of times are caused by, or you have them all year long. Those are caused by the cat. One common allergy is actually to dust mites. Right? So that particularly if you find that, your allergies are worse at night or first thing in the morning when you get up, maybe it's your mattress. Maybe you need to, switch mattresses, take a vacuum cleaner, vacuum the mattress real well to see if you can get the bugs off. They'll sometimes even enclose the mattress in plastic just to prevent that from happening. Sometimes the allergy doesn't manifest itself with a runny nose and with a sneezing. Sometimes it manifests itself by a rash. Frequently, those are caused by something you might eat. By that, peanuts, strawberries are real common. This would be a blotchy rash that would come possibly all over you that would itch very badly. Again, those are worthwhile. If it's all over, those are worthwhile seeing the doctor. If it's just a small area, you could probably get by with over-the-counter hydrocortisone cream. But anything more than small, you probably need to see your doctor. Some people, again, have severe allergies. It can be so severe that their bronchial tubes tighten up and they have an acute asthma attack. Their blood pressure falls, they faint. For those people who've had a bad reaction to an allergy, I'll prescribe an EpiPen. What an EpiPen is a spring-loaded syringe full of epinephrine. And the classic is the field worker who gets stung by a bee. He'll carry that around with him all the time, and if it happens, he'll uncork it, he'll put it on his thigh, fire off the medication. Nobody wants to get a shot, but that could also very easily save his life.
Medtwice.com